Where did avian influenza originate? Have you ever wondered where avian influenza, commonly known as bird flu, first came from? Let's take a closer look at its origins and how it relates to bird health and behavior. Avian influenza is caused by the influenza, a virus, primarily affecting birds. The first identification of this disease dates back to the late 19th century. In 1878, a scientist named Edoardo Perencito in northern Italy recognized avian influenza as a distinct disease. At that time, it was confused with other poultry diseases like fowl cholera. It took years for scientists to confirm that avian influenza was indeed caused by a virus, specifically a type of influenza, a virus. Fast forward to the mid-20th century, when researchers began to understand that many subtypes of avian influenza were common in wild bird populations. Waterfowl and shorebirds are key players in the natural reservoir of this virus. They can carry the virus without showing symptoms, making them important in the spread of avian influenza. One of the most notable strains is the highly pathogenic avian influenza, subtype H5N1. This strain was first identified in domestic waterfowl in southern China in 1996. H5N1 has caused significant outbreaks in poultry and has the potential to infect humans, raising concerns for public health. From the perspective of bird health, avian influenza poses a serious threat. Birds can become infected through direct contact with other infected birds or contaminated environments. The virus spreads quickly, especially in crowded conditions, such as those found on poultry farms. To prevent avian influenza, several strategies are in place. Reducing contact between domestic birds and wild birds is essential. Improving hygiene practices on farms and implementing vaccination programs where available are also important steps. These actions help maintain the health of bird populations and prevent the spread of the disease. In the context of bird behavior and ecology, understanding avian influenza is vital for managing bird health. By recognizing the role of wild birds in the spread of the virus, we can implement effective prevention strategies. This helps protect both domestic and wild bird populations from avian influenza.